Hi, I'm Adam DeVore, and I'm happy to share a sub-analysis of the RELAX trial here with you. So this, first of all, just in a little bit of the way of the background, the RELAX trial was sponsored by the Heart Failure Network, and it was a study of sildenafil versus placebo in patients with heart failure with preserved ejection fraction. And we were interested in using the echocardiograms from that study to try to answer the question, what's the association between left ventricular global longitudinal strain and other baseline characteristics in the study. And I want to highlight just a couple of things from the study. One, this is an objectively defined population of patients with HFpEF. And the endpoint of the trial included a CPX test. So we had a lot of information on the patients in terms of their New York Heart Association functional class, their exercise capacity, and then their Minnesota Living with Heart Failure quality of life questionnaires. And so we hypothesized that there might be an association between the impaired left ventricular strain and some of those other baseline characteristics. And that's what you can see in the results here. So let me walk you through the results. So first of all, an important finding of this study is that it was very common to have impaired left ventricular strain in patients with objectively defined heart failure with preserved ejection fraction. 65% of this cohort had abnormal strain. Secondly, let me walk you through some of the associations that we found and some of the important ones that we didn't observe. This is New York Heart Association classification, and these columns are patients with the worst tertile of left ventricular strain and the best tertile. You can see there's no association between left ventricular strain and New York Heart Association classification. Some of the other important things here is we looked at some of the biomarkers collected in the study. Shown here is procollagen, this is proBNP, peak VO2, and then Minnesota Living with Heart Failure quality of life questionnaires. I think an important finding here is you can see there's a little bit of a modest association between the biomarkers and impaired left ventricular strain, suggesting a relationship of fundamental myocardial abnormalities in these patients. And if you look down here, you don't see any associations with peak VO2 or the quality of life questionnaires. So let me summarize some of these findings. So one, impaired left ventricular strain was common. Second, there were associations with some of the biomarkers, and then some of the other data I didn't show you included abnormal diastolic dysfunction. So it seemed like left ventricular strain tracked with abnormalities of the myocardium, but it didn't track with some of the other important characteristics of these patients, like their exercise capacity, like their quality of life. So I think some of the implications of this are that perhaps other mechanisms may be responsible for those things in these patients, like impairments in exercise function or extracardiac mechanisms, but this really requires further study. So thank you. Hopefully the manuscript will be published in due time, and you can read that as well for more details on this study. Thank you.